This segment of Delmarva Life is brought to you by Peninsula Home Care.
Did you know that according to the Centers for Disease Control, chronic diseases are the nation's leading cause of death and disability?
But having a chronic disease doesn't have to compromise quality of life. You just have to make lifestyle changes and choices that adhere to your prescribed medical treatments.
That sounds easy enough, doesn't it? It's not always that simple, though. That's why Peninsula Home Care and MAC Incorporated, the Area Agency on Aging, are teaming up for a chronic disease self-management program. And to join us today to tell us more are Nancy Bagwell, who's the Peninsula Home Care Branch Director, and Leanne Eagle of MAC Incorporated. Ladies, thank you
Thanks for having us.
so much for joining us. Let me start off. I'm going to get real basic. When we say chronic disease, what does that mean, chronic disease?
Well, in medicine, chronic disease typically means something, a disease process that's long but slow in progression. So long in duration, slow in progression. So it would be disease types such as arthritis, COPD, asthma, or heart disease.
Oh, okay.
Just to name a few.
Just to name a few.
Right, right. So tell me about this partnership you have, Peninsula Home Care and MAC. How did that come to be?
That came about as we go, my forward with the patient-centered medical homes. It's very important to have that my management people and getting people to take charge of their health. So we want to give them the tools in order to make them to use their tools on their body, instead of talking about what is diabetes and what is arthritis. We want to give them the tools to manage their own health.
Because more and more people are going to need this as they get older, right?
Yes, and that's how we teamed up together, because it's a natural fit, because we want to get people into the chronic disease program right out of the home care.
Well,
So
is this really a big need? I mean, is this something you can get from the doctor?
Well, basically, I think it is a big need. The World Health Organization says that chronic disease is the leading cause of mortality throughout the world, 63% of the deaths.
Right.
So while you can get information from your physician, these particular classes allow you to actually put action items and practice what you have learned. So for example, if you are trying to lower your sodium intake from a heart disease, you would actually create an action plan, see how you did the week, and then come back and speak with your peers about what you did well, what you didn't do so well, and how you can improve in that area.
And Nancy, there are a variety of reasons why people have trouble with this self-management, right?
There are, and when we go and we're diagnosed with a disease process, we will oftentimes go to the internet and look up, what's going on with that chronic disease, but we're not always prepared to deal with the other things that come along with it, such as emotional or mental or financial issues. So typically we find self-management becomes an issue because of lack of resources. It could be a lack of financial funding to purchase medication, it could be a lack of transportation to your physician's office, or oftentimes it's just a lack of how to navigate the healthcare system or to have an appropriate conversation with your physician and understand all the medical jargon that comes along with it.
So self-management is really a big part of the new healthcare plan.
It really is. Self-management is going to be more and more where we hold ourselves accountable for our care and less about physicians. There are several phases to that, and over the healthcare reform, they're looking to lower cost, decrease utilization, and also improve your health. So as we go into a physician's office, you're going to hear more about a patient-centered medical home. And what that is each person would be assigned to have a primary care physician who would coordinate their care. These particular classes would allow the physician an opportunity to prove, to be part of that patient-centered medical home, that they have offered a self-management support. Because part of that is each participant has been proven over some studies over the last 2 decades to save between $390 and $520 per participant.
Wow. Okay.
Yeah,
And we talk about money and costs. The good news is you have some workshops coming up, right, Leanne? And they are free.
Yes, and they're all out of Stanford, my medical school. So it's a license, a program that's proven by, my research. We do put our classes on the MAC, on my website, and we will be working with Nancy, and we will get all the my classes and make them.
Now, it's not just for patients, right?
No, patients, caregivers, It's even for the younger population. Anyone can take the class that has a chronic,
It's a 6-week workshop that really deals with things like medication compliance, eating, nutrition, activities about daily life dealing with emotional or depression, and you actually practice those, and it's over a 6-week course, and it's free.
Stuff you need to know. Ladies, thank you so much. Very valuable
Very
information.
good information.
Now, if you'd like to learn more from Peninsula Home Care, including an upcoming class taking place in October, or their chronic disease self-management program, including times and dates, all you have to do is go to our website, delmarvalife.com.